I'm a registered dietitian.
I'm an exercise physiologist.
I'm a cardiologist.
I'm a clinical pharmacy coordinator.
I'm living with heart disease every day.
And I live with coronary artery disease.
So most women are aware of the risks of breast cancer, but the reality is that 1 in 3 women will die of heart disease, whereas 1 in 9 women will die of breast cancer. And that impact is even more significant when a woman has both diabetes and heart disease. So the good news is that diabetes and heart disease are both conditions that can be treated through a variety of lifestyle factors. So women really do have a lot of control over what happens. So ABCs are an important part of the treatment plan for a woman with diabetes. A stands for A1C. It's also referred to as hemoglobin A1C, and that's a longer term, like a big term picture of what your blood glucose has looked like over the last 3 months. So that is a test that's taken in the clinic. It's usually taken every 3 to 6 months, depending on what your treatment plan is and what your goal is. But that differs from when you self-monitor your blood glucose. That gives you a picture of where you're at that very moment, whereas the A1C gives you the big picture of what your glucose has looked like over the past 3 months. So every 1% decrease in A1C, so if your A1C is 8% and you go down to a 7%, you reduce your risk for microvascular complications, things like eye, nerve, and kidney damage by about 40%. B stands for blood pressure. Blood pressure should be tested every time you go into the clinic, and sometimes it's recommended that you measure your blood pressure at home as well. And C stands for cholesterol, and cholesterol includes your total cholesterol, your triglycerides, your HDL or your good cholesterol, and your LDL or your bad cholesterol. It's important to have a conversation with your healthcare provider about what your personal goals are for A1C and blood glucose, blood pressure, and cholesterol. Knowing your numbers is an empowering tool for women to stay healthy and live a healthy life with diabetes. Diabetes treatment plans can vary depending on the type of diabetes a woman has, but there are 3 core components that cut across both type 1 and type 2 diabetes, and those are blood glucose monitoring, a diabetes meal plan, and activity. Blood glucose monitoring can depend on the type of diabetes and how it's treated. For example, someone taking insulin may need to test their blood glucose several times a day, whereas someone who has type 2 diabetes and is treating their diabetes through diet and exercise may need to test much less often. So the most important thing you want to focus on when making changes to your diabetes meal plan is knowing how to identify sources of carbohydrate. Carbohydrate is the nutrient that raises your blood glucose levels the most. So oftentimes women think they should avoid carbohydrates because it raises blood glucose, but carbohydrates are what our body uses for energy. So it fuels our bodies and our brain, so we absolutely need carbohydrates. And many carbohydrate foods like fruits, whole grain, and milk are important nutrients that we need to get in for an overall healthy diet. So you should aim to be active for 30 minutes a day most days of the week. Talk with your healthcare provider about any precautions you may need to take when being active. If you manage your diabetes with insulin or certain oral diabetes medications, sometimes blood glucose can go too low when you're exercising. It's important to test your blood glucose before you exercise if this is the case for you, and talk to your healthcare provider about a strategy to treat low blood glucose before and during exercise. Sometimes eating a meal and then waiting 1 to 3 hours to exercise is a good approach because you most likely have enough blood glucose in your system to get you through your workout. In addition to the core components, a woman with diabetes who has type 2 may need to take oral diabetes medications, insulin, or non-insulin injectables, and sometimes it's a combination of these treatment methods. But it is important to understand that diabetes is a progressive disease, so what works for you today may not be what works 6 months or even a couple years from now. The important thing is to keep your blood glucose in a healthy range to prevent complications, and you'll feel better too. Having diabetes and heart disease can feel overwhelming to women, but the good news is that the healthy behaviors you take to manage your diabetes will also help improve your overall heart health. My name is Gretchen Benson. I'm a registered dietitian and certified diabetes educator.